Hi, I'm Melanie. I'm one of the palliative care doctors here. And I'm going to give a talk on supportive oncology. And I have no financial relationships to disclose. So at first, I just wanted to kind of air the room and ask what people had heard about palliative care. There's a lot of negative associations. Anything? I think what I hear the most is, when it's time for palliative care, it means you're dying. It means it's time for hospice. A lot of people think palliative care and hospice are the same thing. I often feel like this walking through the hospital due to all the misconceptions. So part of the reason I'm giving this talk today is to reassure you and really explain our role and tell you how we can help. So what is it really? So palliative care focuses on the relief of symptoms and stress of serious illness. It's not just for patients who are dying. It's appropriate at any age, at any stage. It can be provided along with curative or life-prolonging treatment, and it can also be provided at the end of life. And a really integral part of palliative care is the interdisciplinary support. So a palliative care team isn't just a doctor, a nurse. We have a wide variety of professionals. So our team here, we also have a social worker and a chaplain. Other teams have psychiatrists, psychologists, nurses' aides. So what do we do? So a main focus of palliative care is symptom management. So those are the physical symptoms, the psychological symptoms, and because we have this interdisciplinary team, I think we're really good at psychosocial spiritual support. So that's why we have social workers and chaplains and nurses, because we're supposed to provide support for the patient and not just the patient. We consider our patient, the patient and their family and their caregivers. So we're here for the whole family, for the whole unit. And then finally, we do a lot of advanced care planning and goals of care discussions. I think another reason I was asked to give this talk tonight is because there is a lot of evidence in palliative care in advanced cancer. So there are a lot of benefits of having palliative care involved in advanced cancer. So there hasn't been studied specifically in melanoma, but in other cancers, they've shown that it improves quality of life, symptom burden, mood, and use of healthcare services. And in one of the major studies of palliative care, it was outpatient palliative care for advanced lung cancer, they also showed an increased survival in the patients that were getting monthly palliative care. And the survival was 3 months. So it was pretty good compared to, there are a lot of cancer treatments that are approved for a 3-month change in survival. So practically, what do we do and how do we do it? So here, I'm primarily an outpatient doctor, but we have both outpatient doctors and inpatient doctors. For the most part, we see our patients in clinic. So Dr. Chandra spoke earlier. I see patients with her in the office, sometimes jointly with her, sometimes after. And then sometimes I see patients during their infusion or when they're waiting between providers. But I think the point is that we try and see you where you already have appointments. We try not to make you come just see us because we know it's a pain to get here, it's inconvenient, and no one really likes being here. But for those patients who aren't being seen in oncology frequently, we also have a separate clinic space in DTI, so we can also see you separately. That said, we do a lot of work over the phone. So we have 2 nurses who a majority of their work is phone calls. So we try to make patients not have to come to clinic if they're not already coming. We can change a lot of medications over the phone. We can give a lot of advice, get even some more support and services at home, all by phone. So we do a lot by phone. And then should a patient get admitted, we're also there on the inpatient service. Okay, so symptom management. This is really, I'd say, the main focus of our work and usually the reason we get involved initially. And I know it often feels like just another pill when you're complaining of a new symptom. So of course, you know what symptoms are. But pain, that's the main symptom that we get involved for. And yes, medications are usually the thing we start with, but it's not just morphine. We use anti-inflammatories, we use neuropathic agents, and we do use opioids. But our goal is to, if a patient's losing function due to pain, is to get them back to an acceptable level of function. So we're trying to get you on the lowest dose of opioids, the lowest dose of pills, and the fewest number of pills that we can. Unfortunately, sometimes we need them. But it's not just medication. So I think part of the reason our clinic works is because we're talking with the oncologist, with the rest of your team when we see you. And sometimes we get radiation involved. Sometimes just one spot is causing a lot of pain and we can target that spot. Same thing with procedures. We work closely with anesthesia and IR. Sometimes we're able to really reduce your medication need by getting these procedures. And because we have extra training in this, sometimes we're the ones that think about it. So along with pain, if any of you guys have been on opioids, you know that constipation comes hand in hand. I'd say that's the thing we manage most by phone, but we can do a lot with that as well. The other symptoms, you know them. So sometimes these are symptoms of the melanoma itself and sometimes of the treatment. So Sue mentioned a lot of the side effects of these treatments, and sometimes we're able to mitigate the symptoms enough that you can tolerate more treatment. And that's our goal, right? Our goal is for you to live as long and as well as possible. So we want to help you continue your treatment, and we want to target these symptoms. And then finally, anxiety, depression. Really common symptoms, especially when you're dealing with an illness like melanoma. So we have extra training in psychiatric meds, but we also work closely with our social workers, with the psychologists, with the psychiatrists. Refer you to who it's really appropriate for you to see. And we can also identify resources closer to home. So we've gotten patients therapists in the home, or we found groups closer to home. And sometimes it just takes a little more work on our part. But it's something, you know, it's hard to figure out these things, and we want to help you identify those resources. Okay, and then I'm going to go to this slide first. So support. I think this is another big part of palliative care. This is why I went into palliative care, because I get paid. This is my job, is to listen to you talk about these things. I want to know what's bothering you, what your frustrations are, your fears, your concerns, because we want to help you. And because I have this team, I feel a lot better about managing these things, about helping you. And I like relying on my team members to fill in my weaknesses. So we really are an extra layer of support. And I know that's how a lot of the teams present us. You know, let's get palliative involved. They're really helpful with these things. They'll really help support you. And again, it's not just the patient, it's the loved ones. So, and the support doesn't just mean this group of people in the clinic or in the hospital. We also involve home nursing a lot, and we can think of other services to get at the home. Okay, and then finally, goals of care, advanced care planning. So what are goals of care? So really, your goal of care is what are you hoping to achieve with this treatment? There are a variety of goals of care. I think I list them on the next slide. So yeah, cure, life prolongation, independence, staying in control. I hear feeling good for an event a lot. You know, someone's undergoing treatment and it's pretty heavy, you know, a lot of nausea or a lot of diarrhea, but they have this big event that they want to feel good for. We can work with you to try and make you feel the best that you can feel on that day. We've done it a lot of times. And we can work with the rest of your team to try and schedule things so that we're able to honor that event. Other ones are relief of suffering, a good death. All of these goals are important. And it's important to hear what your goals are, because treatment should align with those goals. Goals should be realistic too, so we need to hear them because we need to know if we're on the same page. And also, it's a conversation that has to happen over time. as your disease changes, as you change, just as a person, your goals change. So we need to hear them and be updated on them over the disease course. So, and then advanced directives are really, it's making plans for your care based on your goals and values. So ensuring that your wishes and preferences are honored if you're unable to speak for yourself. So this is something that we also help with. And I decided not to talk that much about that today, but that's another area of expertise that we have. So really, if you're gonna see us in palliative care, things that are helpful for us to have: a list of symptoms, questions, concerns. You know, there really aren't stupid questions and concerns when you come to palliative care. Consider including your loved ones, the people that help you make decisions or help care for you, because we need to hear from them too. And then if you have done advanced directives, bring them, we can review them, we can scan them into the chart. So in summary, palliative care, we focus on symptom management, support, advanced care planning. Any age, any stage, we think it's best to offer it early alongside cancer treatment, so don't get scared or say no just because of, you know, all of the negative feelings associated with the term, and it's interdisciplinary. So maybe you don't like me, or maybe you don't like the social worker, but you could still see the chaplain, or maybe you just don't find our work beneficial. There's a lot of people on the team that can be helpful. I think we're just going to do questions at the end. Okay, so you can always call if you have any questions or you want to make an appointment.